Welcome back to Our Chicago. I'm Terrell Brown. This morning we're talking about the monkeypox outbreak with Dr. Cathy Creticos, Director of Infectious Diseases with Howard Brown Health, and Massimo Pacilli, Deputy Commissioner for Disease Control at the Chicago Department of Public Health. Nice to have you both again. Want to pick it up with you, Doctor. Here in Chicago, many cases we know have been diagnosed in men who have had sex with other men in their sexual networks. Why is that?
Well, really, the outbreak started in Europe among a group of people who were socially connected, and the transmission started occurring within this particular social network, and that was the network of men who have sex with other men. And then when it came to the United States, it stayed within that social network. So the virus does not have any predilection for transmission through sex or anything like that, but it's really because these are the people that they're associating with and in our physical close contact with. And of course, intimate contact and sexual contact can transmit the virus as well. So that's really why we're seeing it, but there's no reason why other individuals who are exposed in a similar way through very close physical contact would not be able to get infected. So indeed, that is still a risk for others as well.
So that means women and children could also be potentially at risk for monkeypox.
Yes, the virus can certainly be something that infects other groups of people, such as women and children, absolutely. But again, the social network to date has really not been including that group. And of course, we educate patients as soon as they have a diagnosis of monkeypox, and people really are trying to be very responsible and isolate from family members, from contacts, so that they do not transmit this disease.
Deputy Commissioner, how widespread do you think monkeypox could be in and around Chicago?
Yeah, I think there's a lot we can do to contain that spread. First and foremost, I'd say that identification. So individuals who present with compatible symptoms like described are in a position to seek care, and any provider is able to order a monkeypox test and get the diagnosis. That is fundamental to really describe, to identify those who are infected so that they may be isolated. And then for us to do the work of identifying all the contacts to whom we can provide vaccine to prevent onward transmission. And in addition to that, we can do a lot more in there are three primary pieces that contribute to spread. One is the virus itself, and we're learning a lot, and we'll learn more as we go in terms of how it behaves in the current outbreak. The other is raising the immunity of our communities. And so all of the work that we're doing to really vaccinate those that are at highest risk so that the vaccine we have may do the most good in interrupting transmission is very much front and center, and to do so in a way that it's equitable with regards to access and administration of vaccine. Last piece is about prevention. So behaviors that can preempt that exposure so that close intimate contact doesn't result in infection of the NPV.
And what exactly is that, Deputy Commissioner? I know we got market days coming up this weekend. What does someone do to not get monkeypox?
That's right. And so again, monkeypox infection is the result of that close contact with the lesion, of the fluid from that lesion. And primarily, so that is why close intimate contact is the highest sort of risk factor for infection, different than casual contact that may occur in an outdoor festival, et cetera.
And do you think? Go ahead, Deputy Commissioner. I'm sorry.
Yeah. So I think raising the awareness and leaning into the prevention that is sort of participating in an outdoor festival, it's certainly not the highest risk behavior, but to do so in a way that here is a disease where a layer of clothing may do the job. So that is one intervention. Avoiding those instances where close intimate contact with unknown or those who may be infected with NPV may occur are, again, the highest risk. And so we have sort of engage partners, deliver education and prevention messaging to sort of clearly articulate what is highest or lower risk, and position individuals to kind of engage in sort of a fun summer that is also a safe summer.
Dr. Creticos, want to get you on this really quickly before we go. We don't have much time left. The vaccine, is this used to treat monkeypox or is this used to prevent monkeypox?
It's used to prevent monkeypox. So people who have had direct exposure to a contact with monkeypox would be vaccinated to prevent them from getting symptoms of monkeypox and active monkeypox. If they do still get monkeypox, it's felt that the disease might be lessened or ameliorated. But if you already have monkeypox, the vaccine is really not indicated for you. And as mentioned, we're really trying to save it for the highest risk individuals because there is a shortage of the vaccine.
Dr. Cathy Creticos and Deputy Commissioner Massimo Pacilli, thank you to you both. Appreciate your time this morning.
Thank you.
Thank you.
And that does it for Our Chicago. If you have more questions, we didn't even get to all of ours. If you want more information, we've got it on our website about monkeypox. And both the Chicago Department of Public Health and Howard Brown Health websites, we've got a link to it on our website, abc7chicago.com.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.